How's it going, guys? Pass level question for micro for step one. Before we get started, please subscribe to my channel. I really appreciate it. Give you really appreciate it. Find me on Instagram, mehlman_medical, mehlman_medical. Links down below. Find me on Telegram. Links to the Telegram group and channel down below. Now start the clip. 65-year-old man, persistent fever following a bowel resection for complicated diverticulitis. He's been on broad spectrum antibiotics for the past 3 weeks since the operation. Physical exam shows a central venous catheter present that was placed the day of the operation. Cultures from the tip of the catheter grown on sheep blood agar show purple budding organisms. Question wants to know which of the following is most likely causal organism. So this image here is not me being extravagantly creative. Same fucking image of blood agar plate shows up in one of the offline nbme exams. So let's just whip to the answer choice here. Choice A, Candida albicans, correct answer. Now I said this is pass level. There's 2 main points you need to know. There are risk factors for candidemia, which is candidal infection, candida in the blood. Number 1, it's going to be a patient who's been on broad spectrum antibiotics for at least a couple weeks. If you're killing off the normal flora, you're going to increase the chance that candida can now hyperproliferate. The second risk factor is a prolonged insertion of a central venous catheter. I know it might sound weird, not my fucking opinion, it's just a known risk factor. So the patient has both of these here. Now, even if you don't know that, we'll give you the benefit of the doubt. Where's our starting point? Okay, well, we have budding organisms written in the final line here. Well, bacteria don't fucking bud, do they? So we can eliminate C. difficile right away. Right, it's a bacterium. You say, well, the patient's been on broad spectrum antibiotics, or for at least a couple weeks here. Isn't that a risk factor for pseudomembranous colitis, C. difficile? You're right, but isn't this fucking diarrhea? It's no relation to that here. So C. difficile, you're gonna do stool A/B toxin test. Stool culture is wrong fucking answer, and also you're gonna treat with oral vancomycin. Okay, it's a long discussion, a lot we can talk about. Point is, wrong fucking answer. And then if we look at the other bacterium listed, VRE, vancomycin-resistant enterococci, you say, well, there's been prolonged fever in the setting of broad-spectrum antibiotics for at least 3 weeks. Couldn't it be that he's got VRE? Isn't that possible? You're right, it is possible, but once again, bacteria don't fucking bud, all right? So I don't really know what to tell you. You have to use a little bit of lateral thinking and then eliminate to get to the best answer. So when we're looking at our fungi here, I just talked about Candida, risk factors being broad spectrum antibiotics and central venous catheter. Well, Cryptococcus neoformans, doesn't this cause meningitis, right? Cryptococcal meningitis, that's the high yield association, usually an immunocompromised patient like HIV. And then you're going to have decreased serum glucose, increased serum protein, what the fuck am I saying? CSF. Okay, when you do CSF analysis, decreased glucose, increased protein, increased lymphocytes, sometimes increased opening pressure. This is the whole India ink prep. We have a black background with these large white halo appearing fungal cells. And you can also do latex agglutination, which is actually the most accurate test, most definitive test for Cryptococcus neoformans. And you can rarely do a mucocarmine test for that as well, which is a red smear if they showed it to you. This is the fucking red smear, but it's fucking wrong, so I don't know what to tell you. And then there's Sporothrix schenki, of course, which is your classic rose thorn prick causing a papule on the finger in the garden. And what they love for USMLE is showing you a pink streak on the arm that tracks up to the axilla, or they can show you just erythematous nodules tracking up to the axilla, and the answer will just be lymphangitis. Okay, they can have like arteriitis, phlebitis. The answer is lymphangitis. It's lymphatogenous sporotrichosis. They love lymphangitis for sporotrichosis. You have to know that. Okay, sometimes they won't mention the papule on the finger. They'll just show you the erythematous nodules tracking up to the axilla. Sporothrix, wrong fucking answer. You know the deal. I'm going to make more content. If you like my stuff, subscribe my channel. And I appreciate your time. That's it.